Gynecologists, what is the nastiest thing you have experienced while working? Okay, here you go. I was doing clinicals at a large inner-city clinic attached to a hospital. The first patient of the day was a woman in her 50s who had recently had a vaginectomy to try and combat vaginal cancer. They had gone and removed her entire vagina. I've never seen anything like it. After we removed the packing, it was just a huge, gaping, dripping maw in between her legs. There was absolutely nothing left of her female anatomy. The worst part was how terrible she felt about the whole thing. She refused to let her husband see anything and was in tears the entire time, telling him he should go. She doesn't deserve to have him now. For the most part, he just cried, attempted to hold her hand, and told her he loved her and could never leave. I worked as a medical assistant in a gyno office, and the worst patient we ever had was actually really sad. She clearly hadn't bathed in about a week, and her underwear were stained. She claimed she was having trouble getting pregnant and had a bunch of eggs frozen and wanted a pelvic exam. The smell when she took her pants off was horrific. I'm fairly certain she had mental problems because she proceeded to tell me that she knew how to kill a man and get away with it and could help me out if I ever needed it. Then there was the time I had a 98-year-old patient with severe uterine prolapse. It was horrifying and made me never want to get old. The most interesting thing I ever saw was a patient who was originally developing as a fetus with two vaginas, but they ended up fusing together, leaving her with a string of flesh that divided her vagina into two sides. She didn't know about it until she was 19, when the doctor had a difficult time putting in the speculum because he stuck it into the side of the string that was smaller. Before that, no one had ever noticed. TLDR dirty crazy lady vagina, 98-year-old whose uterus was falling out, and a girl with a flesh string dividing her vagina into two sections. The double vagina thing is called a vaginal septum, and I had one too. Got it removed when I was 23. What's pretty nuts is that I'd actually had a couple of papillaras, and they didn't even notice it until one appointment when I asked them what it was. The doctor got all excited and brought all of the other nurses and doctors in to look at my vag asterisk asterisk asterisk. Pretty freaking awkward. My wife's an OBGYN. The worst case she related to me was a female inmate that had such a bad case of genital warts that it was impossible to discern any specific anatomical structures. It was just a giant mass of warts and infected discharge. She was also 10 weeks pregnant and still sexually active. My dad is a gynecologist and told me this story. He treated a girl that had trick, green, foamy discharge, who had it for months before coming in. He told her to take the medicine right away and continue it completely. A few weeks later, she comes back in, and she still had the green, foamy discharge. My dad asked why she stopped taking the medicine, and she said, "Well, my boyfriend really loves the taste. I gagged so much." Secretary delicious. I was chaperoning a procedure my doctor was doing on a woman. She had an ingrown hair. That hat turned into a cyst on her labia. This doctor wasn't particularly good at cyst extractions and busted the sac. It sprayed in his face. I was retching and trying to console the poor woman at the same time. She was crippled with embarrassment. My mom's a labor and delivery nurse. She sees quite a lot of cooch and swaps stories with gynos all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy shit they stuff in Easter baskets, out of a vagina. She didn't ask, and the patient didn't explain. To be fair, that plastic Easter grass always ends up everywhere. Best Easter egg hiding spot ever. I worked for a family practice as an MA for a while. A patient who we had never seen before called the office frantically trying to schedule an appointment because she was having lady issues. Whatever. We got her in the same day, and after the doctor had talked to her for a while, he told me to prep a pap room. When we walked into the room, the smell hit us like a ton of bricks. The doctor did a few throat clears and sat down at the end of the bed to start the exam. Well, after getting her feet in the stirrups, he lifted her gown, and his eyes went from normal to about the size of dinner plates. This girl had the most severe case of herpes I had ever seen. Her vagina was swollen and a deep red color, covered in a severe outbreak. To make things worse, the piercing she had in her clitoris looked like it was being sucked in by her skin. Her vagina was oozing green and black gunk, and when the doctor inquired a perineal tear, she responded, "Yeah, haven't you ever heard of double penetration?" After the exam was over, we had to convince her that her 4 current sexual partners needed to be contacted about their exposure to several STDs, even though, as she put it was too late anyways, because she never uses a rubber. I have never seen anything so disgusting in my whole life. It still haunts me. Some men really will stick it in anything, won't they? My penis is trying to hide. Reading this thread was a mistake. It is a mistake, but I can't stop. Med student here, and I haven't done my OBGYN rotation yet, so I'm sure there's far worse to come. But during a placement at a general practice clinic, I did see one woman a week after she had given birth. She'd had an episiotomy, a cut from the vagina towards the anus to prevent tearing during the birth, which had become infected. It looked, and apparently was, excruciatingly painful. Edit. No, an episiotomy is not cutting the taint until the vagina and anus are just one big gaping hole. It is a cut in the posterior wall of the vagina, either in the direction of the anus or off to the side, basically just to widen the vaginal opening to aid the passage of the baby if there's a risk of tearing. Well, I'm never having children. Well, I'm not a gynecologist, but my horror stories is going to 6 different gynecologists over 10 years, and all of them dismissing my severe menstrual pain and heavy blood loss as perfectly normal, and telling me to either try yet another birth control pill or just take 800 mg ibuprofen every 4 hours to deal with it. I was finally diagnosed recently with endometriosis that caused a myriad of symptoms, the worst probably being chronic constipation, and of course, severe pain. 10 years and finally the 7th doctor ended up actually giving a shit about my pain. Nurse, not doc, but sometimes after hysterectomy, the patient can get a tear in the vaginal cuff created when they close the end where the cervix used to be. This is why patients are told to avoid sex for at least 8 weeks to allow time to heal. Sex is often the cause of such tears. Most partners come in appropriately mortified and are supportive of the patient who comes in with a vaginal cuff tear. Not this one asshole. He spent the entire time with a smug, satisfied look on his face. He came off as a complete creeper too, making odd remarks to the female staff as well. I've dealt with my share of jerks on the job, including patients who were actively under arrest for violent felonies, but I have rarely felt as strong of an urge to slug someone as I did with this guy. We did screen the patient for domestic violence once we got her alone, and she denied any concerns. I think the guy was simply proud of having and being a big enough dick to do that to the patient. Had a lady who came in with unexplained vaginal bleeding, never had a pap smear. She was around 40 years old, huge great cancerous tumor on her cervix. The gynae tried to take a small biopsy, and the bed looked like a murder scene. I went and booked in for my pap smear the next day. I had been putting it off. Not a gynecologist, but I had a terrible one when I was 19. I had been referred to this guy when I told my GP that my last cycle, about 3 years ago. Long story there is I have PCOS. The problem was how I was told this. After a surprise ultrasound and exam with the blood works, I was told to wait a month for test results at my next appointment. By then, I had turned 20. He calls me in and starts to ask about future plans. Do you have a boyfriend? Do you want kids? And so on. I told him that I wanted kids but was currently single, not to mention I had just started my college classes. So it wasn't something I wanted here and now. Having been told this, he just looks at me and say, and I quote, "Well, that's going to be rough. You have PCOS, which means you have too much of a hormone. But don't worry, I'm sure you can apply for help, and just remember, not everyone needs to be a mom." I was so shocked that he would say that when I had told him I wanted kids, but later, before the anger set in. I called the next day and said I was dropping him due to his rather empathetic treatment. He was right that I would need help getting pregnant, but the way he had said it was with the same tone one would tell they kids to take the garbage out for the 7th time in a row. Retain tampons. The smell is horrid, We usually have to close a room for the day after removing them. On a more serious note, fetal demise is the hardest thing to deal with. Doesn't matter if it's 16 weeks or 40 weeks. The struggle to hopelessly find a heartbeat on Doppler/ultrasound. The mother family looking at you just knowing something is wrong, having to tell them and explain. You grow a bond with your patients from the second their pregnancy is confirmed, and it's devastating to go through that with them. I'll never forget the screams of a 36-week patient who had an ultrasound the day before. 3D4 DUS not diagnostic, but heartbeat was heard. And everything was okay. Office visit next day showed no heartbeat. She was begging for someone to tell her what she had done wrong. My stepdad is a retired OBGYN with 45 years experience. He told me the worst case he ever dealt with was a patient he performed a hysterectomy on just after he finished residency and put the paperwork down he needed for board certification. The examiners noticed that a few days after the surgery, the patient needed 7 units of blood. The examiner was obviously concerned, so my stepdad explained to him that the woman's husband raped her days after a major surgery, and she almost died. He still says that's the grossest situation he's ever been a part of. Edit. My stepdad saved her life and passed his boards. As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was labor. After several attempts, I just could not get an accurate view with the speculum due to the sheer size of this lady. As such, I had to call my resident in for help. As the resident attempted to do a speculum exam on this patient, her first couple of attempts were unsuccessful, as mine had been. However, on her third attempt, she was able to pass the speculum into the vagina cavity. Then the patient, all of a sudden, started screaming really loudly. We weren't really sure what had happened, but upon closer inspection, the woman's penis, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I've ever seen.
Thank you very much for viewing. In the comments under the video, gynecologists can write, "What is the nastiest thing you have experienced while working?" Don't forget to check out our other videos. Enjoy, everyone. Bye.